This video introduces us to the pre-hospital trauma packs carried by New South Wales aeromedical teams. They are also known as the red and blue packs or the primary packs. It is vitally important that our teams have a thorough knowledge of the contents and layout of these packs in order that they can efficiently perform time-critical interventions. In this video, we will look in turn at the blue airway and breathing pack and the red circulation and surgical procedural pack. As it is expected that small changes may occur to the layout and contents over time, this video should be viewed in conjunction with up-to-date lists on the VLE. Inside the lid of each of these packs is a zippered compartment which contains PPE for infectious patients. The basic layout of the blue pack comprises the blue airway box, loaves for adult and pediatric BVM and airway adjuncts, a portable Liddell suction unit in a green zip-up pouch, a small sharps container, the red chest decompression pouch velcro to the inside of the lid. There is also a SAM splint, and underneath the airway box, a chemical warming blanket. If we open the airway box, the first layer we see is what we call the intubation tray. This contains everything that is required for a standard intubation using a bougie and a size 8 tube for a typical adult patient. On the back side of this are size 6 and 7 ETTs, which allows this intubation tray to be used for patients as young as 8 years of age. The tray can be removed and repositioned as necessary to suit the ergonomics of a particular mission. Underneath the intubation tray, on one side is the blue toolkit. This contains an assortment of bougies, stylets, McGill's forceps, different laryngoscope blades, and other adjuncts that may be required for a non-standard intubation. On the other side, in high-vis orange, is the rescue flap to rescue a failed laryngoscopy attempt. This includes a variety of sizes of iGel LMAs and a prepackaged surgical front of neck access kit. On the back side of the rescue flap, secured by yellow Velcro tabs, is a needle crike kit, NG tube, and an array of suction catheters. Inside the blue pack is also a orange coloured clear vinyl loaf that contains the adult BVM and a adult size mask. Underneath this is the pediatric BVM loaf, which, in addition to a smaller pediatric BVM and a variety of masks, has a pediatric insert with adjuncts designed to go into the intubation tray for intubations under the age of 8, and an array of ETTs from size 2.5 up to 5. This picture shows the pediatric insert occupying the central position of the intubation tray and allows for quick access to the appropriate size NPA and OPA, as well as brown tape for securing the tube. The chest decompression pouch contains forceps, a scalpel, chlorhexidine bundled together for a open or finger thoracostomy, as well as 2 Russell pneumofixes, Portex intercostal catheter bags. The size 12, 20, and 32 ICCs themselves are laid flat along the bottom of the blue pack. The red circulation pack has a number of different colour loaves, as seen in this picture from above. It also has the bright yellow medication pouch, a pouch for the pre-hospital ultrasound, a monitoring pouch, a T-pod pelvic splint, and an adult and pediatric size cervical collar. The first loaf is a blue loaf, blue for fluid. This has giving sets, 2 500ml bags of Hartmann's and hypertonic saline. The green loaf is where we find our surgical dressings, including quick clot, an Olaus compression bandage, tourniquets, and a variety of pads and gauze. There's also a roll of cling film for coverage of burns. In the red loaf, which is our surgical kit, there is a second thoracostomy kit, there is a maxillofacial kit, there is what we call a thoracotomy roll with a variety of surgical instruments laid out in a soft material roll that spreads out for a number of pockets, as well as sutures, staple guns, and other procedural equipment. The grey loaf is where we find vascular access, including kit for standard IV, a variety of different intraosseous needles and the EZ-IO driver, and a 7 French trauma line with associated dressings. The yellow medication kit has all of the meds we would anticipate using in the pre-hospital environment. Note that the inter-hospital pack has different medications focused more on advanced critical care, cardiac meds, etc. Finally, I need to mention the topic of pack checks. These serve a very important purpose, ensuring that our kits are ready to be used by the next team. They also act as an opportunity to familiarise ourselves with the packs. Each of the red and blue packs has a name, and they undergo a full check of all expiry dates once a fortnight. This is guided by the pack dashboard with links from the communication book telling us which ones are approaching or have expired and need to be checked. The cloud-based checklists are accessed on a device via QR codes that are present throughout the base, and they bring up the appropriate checklist which needs to be completed in full. There are 2 levels of checks. In addition to the full fortnightly check, it's highly likely that at the end of a mission, there will be 1 or 2 loaves and possibly, for example, the airway box that has been opened and that therefore needs to be restocked. Once the checklist has been run through and we are confident that all of the equipment is in the pack, that loaf or that component gets tagged, and that acts as an assurance to the next team that that pack is in fact complete and contains no surprises. In this situation, where one or two loaves are being restocked, but the rest of the pack is not undergoing a thorough fortnightly check, it's important that the tags all reflect the initial date of the last full check, unlike the picture on the left where you can see a variety of dates written on the different loaves. This ensures that the pack remains in sync and will not be missed at the next fortnightly check. If any equipment is found to be unserviceable or missing or has been lost, a cardboard US tag should be attached to the bag, and it should be made clear that there is an incomplete set of equipment within. An email should be sent to the equipment officer outlining the issue and any unserviceable equipment isolated from use. Thank you.